This is Dr. Rashel Tahzib, and I want to take a little bit of time to talk to you about birth control pills. What are birth control pills? What are their benefits, and what are their possible side effects? Birth control pills are prescribed very commonly for birth control. They're also prescribed very, very commonly by traditional physicians for other medical illnesses such as polycystic ovarian disease. They're prescribed for symptoms such as premenstrual syndrome, PMS, mood changes with your periods, menstrual irregularity, acne, and even irritable bowel syndrome. I've seen birth control pills prescribed for that. We see advertisements on TV very commonly for birth control pills just to not have a period. What does this really mean for you? What does it mean when you're taking a birth control pill? What does it mean to not have a period? What is in a birth control pill? This is a discussion that often is not had with patients by traditional physicians. What are the side effects of birth control pills? What are birth control pills? Birth control pills are synthetic hormones. Synthetic meaning a chemical structure or a function unlike that in the female human body. Synthetic estrogens and synthetic progestins. We have natural estrogens and natural progesterone in our body. These synthetic estrogens and progestins function to put your body in a state of menopause, essentially, so that the body sees a lot of hormone around, the brain signals to the organs and the ovaries not to make hormones because it sees hormones around. The problem is that the hormones, the synthetic estrogens and the synthetic progestins, do not have the same function as natural progesterone and natural estrogen in our body. So sometimes patients on birth control pills may start to have certain side effects. They may not feel the same as before, may gain a little weight, or their sleep may be different, or changes in hair. The longer you're on them, the more you may notice this. Gastrointestinal disturbance. You may not always connect the dots, but these can be attributed to some of the side effects of birth control pills, which we will go on to discuss. One of the side effects of birth control pills is with synthetic oral estrogens in birth control pills, and these are quite inflammatory. It means they increase inflammation in the body, and inflammation is basically the ground state of all disease. Is not to our best benefit to have high levels of inflammation in the body. C-reactive protein is a marker for inflammation, and when tested in many patients on birth control pills can be seen as high or elevated. Synthetic progestins also have different functions in the body as natural progesterone. Natural progesterone has a natural calming effect, a diuretic effect, other benefits in the body. Synthetic progestins can have opposite effects. They can also cause high cholesterol and lipid problems. Another problem seen with birth control pills is that they elevate levels of a molecule called sex hormone binding globulin. Sex hormone binding globulin does just that, binds up free hormones, so all our other hormones. When tested in almost all patients on birth control pills, elevated levels or higher levels of sex hormone binding globulin are found. And what does this mean for you? High levels of sex hormone binding globulin bind up your other hormones like testosterone and thyroid and DHEA. This puts the body in a state of premature aging, but also having low thyroid can cause weight problems or fatigue or water retention or hair loss. Another problem seen with birth control pills is that they can increase and do increase intestinal yeast or candida. Candida is a whole other story and can cause many problems and wreak havoc in the body. And for more information on that, I have a YouTube webinar called Love Your Gut 1 and 2 by Dr. Rashel. So by increasing candida in the body, they can cause dysbiosis or other imbalances in the gastrointestinal system and cause other illnesses. Another problem with birth control pills, and this is could potentially be a very serious one, is that they can trigger new onset autoimmune disease in predisposed patients. So if you are prescribed a birth control pill for any reason, it's important that you have this discussion with your doctor and that you ask your family, your mother, your father, even aunts, uncles, if anybody has suffered from an autoimmune disease. Even if they have not, you may still have the genetics for it and be predisposed to it. Autoimmune diseases include, there's many of them, but they include lupus, systemic lupus erythematosus, or Hashimoto's thyroid disease, or rheumatoid arthritis, or ulcerative colitis. Some of these diseases can potentially be deadly and cause end organ damage, and they're chronic lifetime diseases that can cause a lifetime of difficulty. They're very hard to diagnose. They're not easily diagnosed. Symptoms may just be fatigue initially. So just the autoimmune diseases in and of themselves are difficult to diagnose. So it's important to take into consideration the side effects of the medication. And I believe that it's a good thing to use birth control pills for birth control. Try to use them for a short duration of time. When we start to use them to mask symptoms of other illnesses, such as polycystic ovarian disease, or hormonal imbalances, or menstrual irregularities, or acne, that's when the problem arises. Because these problems, these symptoms are actually manifestations of other imbalances in the body, and the appropriate way to treat them is to investigate their cause by doing appropriate analysis of your hormones and looking at the ranges and doing these tests in the right time of the month. And the ranges are very wide, so looking for the optimal levels for that period of time in the month. That's how you diagnose why you would have a hormone imbalance, why your period would be irregular, if the reason is hormone imbalance. Other reasons for some of the problems we discussed can be toxicity, environmental toxins, mercury toxins, nutritional deficiencies, nutritional imbalances, gastrointestinal toxicity, gastrointestinal imbalances. All of these problems, blood sugar abnormalities, underlying insulin resistance. This may sound very medical, but these are all illnesses and underlying problems that can show up in your body when you're young as hormonal imbalance or PMS or acne. These are actually the body's early signs telling you to pay attention. There may be something a little bit deeper. And so if these are appropriately looked into, this can prevent future problems for you. So if you're prescribed birth control pills and these problems are not investigated appropriately, the problem can go unnoticed. They can get bigger and can result in bigger and deeper and potentially chronic lifelong illnesses or premature aging or symptoms you did not ask for. So it's important to look to the side effects of birth control pills and take them when necessary. It's also important to read the insert. All of these side effects are written in the insert of all birth control pills, and all birth control pills, no matter the brand, no matter if it's low estrogen or I don't want to name any, they're all very similar. No matter which brand you're taking, they are all synthetic in that they are all synthetic oral estrogens and synthetic progestins and have the side effects we discussed together today. I'm glad you had the chance to join me today, and this is Dr. Rashel Tahzib, and stay tuned for our next discussion.